afternoon, ladies and gentlemen. This information or a publication piece of opinion, which is a collaboration piece between the University of Cambridge and the University of Khartoum, and it will be presented by educators from Cambridge and from Khartoum as well. So authors don't have any conflicts of interest to declare. So I'll talk to you quickly about the background of telemedicine, and in fact, if you think about telemedicine and if you enter it in a search platform, or if you do a literature search on telemedicine, you'd come up with stuff as such. You'll come up with EMR using cloud, augmented reality, telemonitoring, e-health, and the chain that my colleague has spoken to you about in a few moments ago, artificial intelligence, and so on. Whereas if you go back in the day and look at the World Health Organization definition of telemedicine, you come up with this. And actually, if I just focus your mind on the important aspects, which are distance, delivering health from distance, using technology, using information and communication, using research and evaluation, and also educating healthcare providers for this aspect. What we've decided to do is to ask ourselves this question. Are we ready for telemedicine? For instance, is a low-income country, using Sudan as an example, is it ready for practicing and applying telemedicine? And you have to actually go at this answer the right way. You ought to think about healthcare professionals individually and the delivery of healthcare to patients in two separate entities, in the background or in the context of a low-income country like Sudan, for example. For the aspect of healthcare professionals, what you need as a platform to be able to produce or to implement this concept is an updated medical education, good IT training, research and data gathering, bespoke guidelines targeting the area, the region, the people, the Sudanese people, etc., knowledge transfer concepts, and improved globalization. Whereas for the delivery of patient aspect, what you need is good patient's education. For instance, a patient should be able to use software to implement telemedicine technology, improved communication, cost-effective healthcare, patient empowerment, IT training, mobile apps, for example, and increased risk awareness for patients to come, for instance, and present early if they have a problem like cancer and so forth. And the highlighted items here we have worked upon using this collaboration between the two institutions in Cambridge and University of Khartoum. So to summarize, the categories that we're going to talk about in this presentation today are international partnership, which will be presented by one of my colleagues from Khartoum, cost-effective access to healthcare, which will be presented by one of my colleagues from Cambridge, and teleconsultation concept as one of the items that we've capitalized on as well. And I would like to introduce my colleague, Rayan Ibrahim, who is a lecturer in the University of Khartoum, the Department of Community Medicine.
Thank you very much. Enlightened by the SDG 17 vision and international cross-sector collaboration between the top-ranked universities in England, the University of Cambridge, and in Sudan, University of Khartoum was established. This collaboration was implemented in the pursuit of this collaboration was implemented in the pursuit of improved knowledge transfer and the effective capacity building, not only for the sake of not only toward achieving the SDG 3, health and well-being for all, but also toward SDG 4 by acquiring relevant skills and also hopefully expanding in the near future the number of the scholarships for the developing countries. This collaboration project started with a medical convey that Ahmed will elaborate more in a few minutes, but this convey was of educational nature, where a team of educators and physicians from University of Cambridge came and conducted several lectures about scientifically approved methods for studying and research comprehension, among other things. Also, we had case studies and discussions led by the students themselves. This team from Cambridge with their colleagues from Sudan and the students, they actually assessed patients, taking history, conducting clinical examination, and so on. And these graphs in the middle here, they show the satisfaction of the students with each educational method. Not only this slide actually, it shows all those graphs are, those in red are pre and those in blue or purple, they show the post-assessment level of the confidence of the students. And as you can see, they demonstrate a tremendous improvement in the confidence level of the students in conducting the aforementioned skills and even more. Through this collaboration, Khartoum team managed to send 6 of the students in an observer program conducted in October this year, and these are some of the pictures of the student there. Moreover, a joint publication about the medical convoy experience was published as an outcome for this collaboration with authors from both institutions. Such publication, as you know, help in strengthening the ranking of the universities. With all these benefits of the partnerships and collaboration, we actually aim at seeing more national and international universities in such program. And from here, I will handle the mic for Ahmed to tell you about
this graph here shows how we try to kind of use the local kind of people from students and educators here in Khartoum to design the whole concept of the program. And as you can see from the diagram here, all those people in those areas, I appreciate that the projector is not showing the things very clearly, but I'll try to go through them quickly. So this is the financial secretary, logistics secretary, operational secretary, educational secretary, and research and development secretary, and the president. So from the president down there to whole the hierarchy of the people working in this project were people from here, from Sudan, participating in this. And all those secretaries and the presidents are actually students in the University of Khartoum Faculty of Medicine, with the most senior one of them in the 5th year of medical school, and the youngest of them in the 2nd year of medical school, who was the financial secretary in this program. And then from there, they lead all the hierarchy for 2 educational groups who are conducting the medical service in the villages that we visited, and we treated people there. So we have each group, Group A, Group B, and Group C. In each group, we have consultants who are consultants in medicine, supervising the overall treatment of the patients. We have pharmacists, and we have 25 students in each group. And all the force and power, kind of planning and management and all the soft skills were led by students. So we were only kind of supervising all those things. And we used the telemedicine and telecommunication to organize all this hierarchy and all this program from Cambridge before we arrive here to Khartoum because of the limitation of time and so on. And this actually worked quite well to empower the local professionals and to improve not only the students, but even the local educators from here, from Khartoum. And as we go on, we try to introduce something, because the concept of medical convoys and taking the resources from the center, from Khartoum, and taking it to the less privileged areas, in the rural areas, is not new, especially in the University of Khartoum, and this has been going for tens of years. But we try to do this in some sort of view which is very well conducted. We so introduced the concept of the triage, which helped us to collect more information in a systemic way that can be published and provide a much needed information about the health care and health system in Sudan as well. So we collected all these data from the patients that we saw. This graph on the left-hand side is showing the blood pressure for all the patients that we've seen. And all this data has been collected, and the research in training has been conducted for students to collect all these data. The best person who can speak about this as well in a layman kind of terms, this is my colleague from Cambridge who came with us and went with us to all those kind of medical convoys. And he tried just to reflect his personal experience for all the people through YouTube. And this is just a short video to show you what happened. So it's better than talking. You can watch this video and you will learn from it as well. All right, so I've been noticed that the time is running out. So I'll hand you quickly to my colleague Hiba, who's going through this as well, just to finish up.
In the upcoming slides, I will try to go in a hurry to share with you an example of teleconsultation and telemedicine. Our patient is a 20 years old male who presented with chronic headache and he presented with visual deterioration and chronic headache over a month. He had no past medical history or drug history. The patient, we did with him a face-to-face consultation. On clinical examination, there is a reduced visual acuity, and by temporal field defects معناه الزول ما بشوف الجزء الخارجي من العين، النص الخارجي للعين ما بشوف به، فهو بشوف just الجزء الداخلي من العيون الاثنين. After that we did a laboratory investigation for the patient, which revealed central hypogonadism and marked elevation of prolactin level. Serum prolactin was 57,000, which is more than 10 times of the upper limit of normal. MRI was done. As we can see, this is MRI coronal and sagittal section. There is a large, huge mass occupying the cellular and supracellular region with encasement of the adjacent vessels. We manage the patient by dopamine agonist and online platforms. We follow the patient by online platforms, social media, especially the WhatsApp, and with aid of DICOM transfer for image, clinical and biochemical and radiological assessment. We counsel the patient for his situation, for the side effects of the drug, and genetic screening of his family members also is done. And let me share with you the good news that there is marked clinical improvement of the patient's situation, which is evident by reduction in the prolactin level and the size of the tumor. This is a graph which shows the rapid reduction of prolactin level in the subsequent lab result. The last one was 4,000. And if we compare the images before and after, there is a great reduction in the size of the tumor from the previous images. Just a few words about teleconsultation ecosystem. احنا بنعمل التليكونسلتيشن عادة في حياتنا اليومية، خاصة هنا كأطباء سودانيين. السوشيال لايف حقتنا بتفرض علينا انه بتمشي عرس عادي، زول بيديك انفستيجيشن بيقول لك شوف لي معاك ابلح شنو، او يرسل لك صورة بالواتساب انا اعمل شنو. فهي التليكونسلتيشن can be of great benefit if it is done in right way. فدي hints بسيطة انه لما نعمل تيلي كونسلتيشن في حاجات بسيطه لازم نركز عليها. منها انه البيشنت يكون عارف انه عنده فرصه تو اوبت اوت whenever he want that. يعني لو هو عايز يوقف، عايز يمشي تو فيس كونسلتيشن اتس اوكي. لازم يكون عندنا دوكيومنتيشن لاي حاجه بنعملها للعيان، سواء كانت انفستيجيشنز، مانجمنت بلان، اي حاجه تكون عندنا لها دوكيومنتيشن. ولازم يكون عندنا برايمري لوكال كلينيشن، زول يكون ان تشارج معاك، لانه انت بعيد والعيان بعيد، فلازم يكون في زول مع العيان في نفس البلد، عشان في حاله اي emergency او new physical signs لازم يكون في someone to act against الحاجه دي. By this I finish. I will hold the mic for Waiel to conclude.
Okay, so thank you very much, everybody. So the one last slide that I would like to share with everybody is that we can apply this telemedicine concept in Sudan. It's a low-income country, but we need to work collaboratively. We need a good methodology to ensure that we cover this efficiently, and we also need the environment to be set up. Now, all of these methodologies, and I'm sorry that the video didn't work, and also the restraints of time are done from distance. So we can perform telemedicine in Sudan as a low-income country, and that's an evidence of that. And thank you very much for our collaborators and friends. No problem. Thank you.
بنحلم بفضاء أوسع بنحلم بزمن أجمل بلاد ميلاد بلاد ميلاد بنحلم بفضاء ووسع بنحلم بزمن أجمل